What are the potential impacts on public health and drug policy of a Canadian province's proposal to provide free fentanyl to minors?
Death and destruction, like fentanyl is a crazy, crazy opiate narcotic. No minor should be given fentanyl under any circumstances. Like you could say, okay, maybe some medical surgery to do this and this and that, like as a one-time thing, but no one should be given medical fentanyl to use. Like this is insane. The opioid crisis has been exacerbated by the safe supply conundrum. We already have a system where people are getting, dillies, which is, I think hydromorphone. I can't remember exactly what it is off the top of my head, but you have these sort of narcotics and opiates which are being given out for free. People then get them and they sell them as currency, and then they use them to buy up, get fentanyl and get hooked onto fentanyl. So we're just going to skip the step and just replace the dillies with fentanyl in the streets, and it's absolutely insane. Where this is a system where like no one can admit they were wrong here, and it's insane. No one can say, you know what, we were wrong about safe supply. Maybe just giving opium to people for free and flooding the streets with more opium created more opium addicts. Listen, opium is addictive. We've known this forever, right? There's a famous war fought over all of this. To give people more opium, stronger opium, for free, as safe supply. We've already seen what safe supply has turned our streets into to increase the potency of the opium on these streets coming in for free. It's beyond insane. It's beyond insane, and I would argue it's outright malicious.
Why do you think we have this policy and we have these kind of proposals in Canada?
It comes from a long line of sort of addiction treatment being, let's say, classically unforgiving, right? The standard addiction treatment was suck it up, abstinence, the 12-step program, turn to God, give it over, find Jesus, and get off drugs, you loser. Which for some people actually works. It works better than safe supply. But for a lot of people, that wasn't the way. We needed harm reduction. And the harm reduction strategy was, okay, if people are gonna be addicted to opium and it has a real physical addiction, we can solve it with like methadone, which is a opiate that doesn't get you like high, but it gives you the opiate section so you can function, right? You don't feel that massive withdrawal. But we got lost along the way of sort of the harm reduction into the safe supply, and this kind of got mixed. Where the harm reduction is sort of in the middle here, where yes, the classic harm reduction is we always wanted people to do less drugs, and if they were going to do opiates, we should get them onto the safest, least potent opioid they can, so they can function the best in society, to wean them off of it and eventually become drug free. But then we got into this sort of hyper progressive. We can't make moral judgments about anything, right? And it's a social constructionist argument, so it doesn't like the fact that there's being personal responsibility placed on the drug addict themselves, right? No, it's societal problems. If we fix society, then that fixes the individual. But then you had this sort of sliding into like outright safe supply, and you had this shift where, the sort of harm reduction doctors were like, a bit vilified by the establishment, abstinence doctors. But then it just became this massive swing leftwards. You can call it that, but it's always a messy distinction when you talk politics. But you have this massive swing where it's now hyper progressive, where anyone who disagrees. So now the classic harm reduction doctors who are to the right, let's say, of the safe supply doctors, they're being vilified as like the most extreme, abstinence-based doctors used to be. And you have a system where doctors are scared to speak out now, right? Post-COVID, the medical institutions basically issued fatwas that any disagreement with the medical establishment is tantamount to losing your license. And that was an insane ruling that has massive consequences outside of COVID. And this is one of those places where you see a lot of doctors, they can't speak up or are afraid to speak up about lunacy because the regulatory bodies, which are often insane leftists, will come in and try and destroy them. So everyone knows this doesn't work, but we can't admit it doesn't work. And it's predicated on the fact that, if we stop shaming the addicts, if we stop doing this, right? If we just acknowledge that addiction is the result of capitalism or colonialism or whatever ism I want to blame right now, instead of drugs and maybe a bad family and some impulse control and all that, we can fix that. So you've seen this massive swing where, the great honor is the harm reduction doctors have always kind of been right. And even though they were sort of like, propped up for a bit, they've always been vilified. And now you have these insane safe supply doctors try and market themselves as harm reduction when they're not really doing that. So it's a massive failure of progressive thinking. And we're also in a land where no one can admit they're wrong. No one can say mea culpa. No one can say, hey, I thought this, I was wrong. The stats have shown out I was wrong. My bad. No one is capable of doing this in any level of our society. So we will continue to go headlong into the abyss.
Speaking of an opioid crisis in Canada, what should be done to address it?
Obviously, not doubling down on the safe supply. The number one thing is don't flood the streets with opium. That's number one stuff. Get rid of the safe supply stuff. Get rid of it. Addicts need to be put in treatment. Okay. I'm not saying throw them in jail for 10 years for blah 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 and all this, but we sort of went to safe supply following like the Portuguese method. I mean, if you're of my generation and you grew up in Canada, you always heard about how Portugal decriminalized all drugs and things got better. But we didn't take the Portuguese method. The Portuguese method is not, hey, decriminalize drugs and let everyone do what they want. It's like, no, if you get caught with drugs, you're not sent into a prison, you're sent into rehab, right? But in Canada, it's like, oh, you're caught with drugs? Oh, here's more drugs. That's insane. So if people are caught high on whatever and they can't function, take them and try and throw them into rehab. Try and clean up as many of these people as you can and stop flooding the market with cheap, powerful opioids. Because when there's cheap opioids, drug dealers are going to get them and start selling them to kids in high schools, because that's where drugs go. And like, we want to pretend that's not what's going to happen, because no, my 15-year-old boy is an angel. He would never do that. Sorry, he's 15. He's an idiot. He can get pressured by his friends who are also 15 and also idiots. So they're going to make bad decisions as a group. Like, your 15-year-old boy, girl might be a smart person, but they're still 15, which means they're an idiot. And they talk to other 15-year-olds, which are also categorically idiots and will do stupid things, which is fine. We need that in society, right? There's a function to teenage boys going around as idiots and blowing off steam, and there's a function to 15-year-old girls being idiots and causing drama for themselves. It's a bit of a learning experience. We grow, but we still have to protect them because they're kids. The failure to acknowledge reality here is the number one problem in my view. But stop flooding the market with cheap opioids or free opioids, and you'll have less opioids.